Welcome to the Deep Dive. Today, we're going to be diving into something that I think affects a lot of people, millions of us actually, and that is how to manage heart risks when you're also living with diabetes.
And this is it's critical because people with diabetes are actually 2 to 4 times more likely to develop heart disease.
Wow, that's a scary statistic.
Yeah, it really is. But the good news is you've provided this fascinating section from the 2025 American Diabetes Association Standards of Care Report.
Okay.
We're calling that DC25010.pdf. It's going to be our roadmap today for this deep dive, and it's packed with really practical advice based on the latest medical research.
Okay, so DC25010.pdf it is.
That's right.
What is the biggest takeaway?
So one thing that really jumped out at me was the emphasis on this comprehensive approach.
Okay.
It's not just about keeping your blood sugar in check. It's about looking at the whole picture, your blood pressure, your cholesterol levels, even how you live your life.
Yeah.
All these pieces fit together when it comes to your heart health.
So it's like we're putting a puzzle together, and each piece is really important for that final picture.
Exactly. And the report doesn't really sugarcoat things. It comes right out and says that the leading cause of illness and death for people with diabetes is something called atherosclerotic cardiovascular disease.
Okay, I'll admit that sounds a little intimidating. What does that even mean?
It's actually simpler than it sounds. It just means the hardening and narrowing of the arteries,
Okay.
which can lead to all sorts of heart problems.
Okay, that makes sense.
Yeah,
So this report's basically our guide to preventing that from happening.
you got it.
Okay.
It dives deep into how diabetes itself increases your risk for things like heart attacks, strokes, heart failure, even problems with blood flow to your legs and feet.
This is already really eye-opening. So where do we even begin with all of this?
Well, the report tackles blood pressure management right off the bat.
Okay, so what's the ideal blood pressure that I should be aiming for?
So they recommend keeping it under 380.
Okay, that seems pretty specific. Is that a number that everybody with diabetes should be aiming for?
That's a great question, and this is where things get really interesting because the report actually emphasizes a personalized approach,
Okay.
meaning your ideal blood pressure target might actually be different based on your overall health, and any other conditions you might have.
So working closely with my doctor is key here.
Absolutely. They can help figure out, the right target for you.
Yeah.
Now, one of the studies they mentioned is this SPRINT trial. It showed that in people at high risk for heart problems, getting that top number, the systolic blood pressure below 120 actually reduced their risk of heart attacks, strokes, and other cardiovascular events by a whopping 25%.
Wow. 25%. That's a pretty compelling reason to pay attention to blood pressure.
It is, but the report also acknowledges that hitting these targets can be, it can be tricky.
Sure.
It often takes a combination of medications and lifestyle changes to get there.
So it's not just about popping a pill. It's about making changes to how we live, too.
Exactly. And speaking of medications, the report also dives deep into cholesterol management, specifically the role of statins.
Okay, statins, I know those are important for heart health, but what's the latest advice for people with diabetes?
Well, the report strongly recommends statin therapy even for people who haven't had a heart attack or stroke yet.
All right.
This is what doctors call primary prevention,
Okay.
stopping heart problems before they even start.
So they're saying statins are important even if I'm feeling healthy right now.
Exactly. For folks who already have heart disease, what we call secondary prevention, the goal is to get that bad cholesterol, the LDL, down by at least 50% from where it started and aim for a target below 55 milli-GDL.
Wow, that seems pretty aggressive. What if someone can't tolerate statins? I've heard they can cause muscle aches and things like that.
That's a common concern, but don't worry, the report talks about alternative medications too, like ezetimibe or PCSK9 inhibitors.
So even if statins aren't an option, there are other ways to manage cholesterol.
Absolutely. They even mentioned a newer drug called bempedoic acid that works in a similar way to statins, but without the muscle side effects.
That's great news. It sounds like there's a lot more to learn about statins and other cholesterol-lowering medications.
There is. And speaking of things that can help protect our hearts, let's move on to aspirin therapy.
Okay, aspirin? My grandma used to swear by a daily aspirin. Is that something that everyone with diabetes should be doing?
Not so fast. The report's stance on aspirin is a bit more nuanced.
Okay.
They recommend aspirin for people with diabetes who've already had a heart attack or stroke.
Okay, so it's about preventing a second heart attack or stroke.
Exactly. But for people who haven't had a heart event, the benefit of aspirin is less clear.
Okay.
There was this big study, the ASCEND trial, which showed that while aspirin did lower the risk of heart problems, it also increased the risk of major bleeding.
Oh, wow.
Yeah.
So for someone like me who hasn't had any heart issues, taking a daily aspirin might not be the best idea.
It's definitely a decision to discuss with your doctor. They can help you weigh the risks and benefits based on your individual situation.
This is already so helpful. I'm starting to understand that there's no one-size-fits-all approach to managing heart risks with diabetes.
You're absolutely right. And speaking of personalized approaches, let's talk about some newer medications for type 2 diabetes that are really, shaking things up in the world of heart health.
Okay, I'm all ears.
Yeah.
What are these game changers?
We're talking about SGLT2 inhibitors and GLP-1 receptor agonists.
Go.
And what makes them so revolutionary is that they not only help manage blood sugar, but they also have a huge impact on heart and even kidney health.
Wait, so they do double duty. That's amazing.
It is, and the report is packed with evidence from clinical trials to support these claims.
Okay, so we're not just talking about theories here. This is based on real science.
Right, we're going to get into the specifics of those studies in the next part of our deep dive.
Okay.
But before we do that, there's one more crucial piece of the puzzle we need to discuss, and that's lifestyle.
Okay, lifestyle. I have a feeling I know where this is going. Diet and exercise.
The report doesn't just focus on medications. It strongly emphasizes the power of a healthy lifestyle to protect your heart.
So even with all these new medications, the old advice still stands.
Absolutely. It's not an either-or situation.
Okay.
It's about using both medication and healthy habits to get the best possible outcome.
This is making me think about my own habits. What exactly does the report recommend when it comes to lifestyle?
Well, they highlight the usual suspects: eating a healthy diet, getting regular physical activity, managing your weight, and saying no to smoking.
Okay.
They even specifically recommend something called the DSH diet,
Okay.
which has been shown to lower blood pressure.
I'll admit, I used to think the DSH diet sounded about as exciting as eating cardboard.
I know what you mean, but trust me, once you start experimenting with some recipes, you'll find that it can be delicious and satisfying.
I might have to give it another try then.
I think you'll be pleasantly surprised. So we've covered a lot of ground in this first part of our deep dive. We talked about the scary statistics, the importance of a personalized approach, and the exciting new developments in diabetes care.
Yeah.
But we're just getting started. In the next part, we'll delve even deeper into those groundbreaking studies that are changing the way we think about heart health for people with diabetes.
I can't wait. This deep dive has already given me so much to think about.
Great.
Yeah.
So what's fascinating is how much research has actually gone into understanding the link between blood pressure and heart risk in diabetes.
Yeah.
There's this whole world of clinical trials that we can learn from.
Yeah. You mentioned some of those trials earlier. What makes this so important?
Well, take the EC-CORD-BP trial, for example.
Okay.
It focused specifically on people with type 2 diabetes.
Okay.
And looked at what happens when you try to control blood pressure really tightly.
So aiming for that lower target we discussed, like below 1,208.
Exactly. They compared this intensive approach to a more, standard blood pressure plan.
Okay.
And while it didn't significantly reduce the overall risk of things like heart attack, strokes, or death from heart problems,
Okay.
it did reveal something pretty incredible.
Okay. I'm on the edge of my seat. Tell me, what did they find?
Well, the group with the tighter blood pressure control actually saw a 41% reduction in their risk of stroke.
Wow, 41%. That really puts it into perspective. Strokes are a major concern for anyone, but especially for those of us with diabetes.
Absolutely. But the report also points out that, shooting for those lower blood pressure targets can sometimes come with a higher chance of side effects.
Right.
Like dizziness or fainting or problems with your electrolytes.
That makes sense. It's all about finding that right balance, especially for those who are older or dealing with other health issues.
Right. It's about weighing the potential benefits against the potential risks. And that's where personalized medicine comes in.
Yeah.
Your doctor can help you figure out what's best for your individual needs.
It's like a customized plan just for you, so it's not a one-size-fits-all approach.
Precisely. Now let's shift gears for a bit and talk more about cholesterol management.
Okay.
Specifically those statins we touched on earlier.
All right, statins, you mentioned that the report's a big advocate for them, both for preventing heart problems in the first place and for managing them after they've occurred.
Yep. And they actually dive deep into the why behind that recommendation.
Okay.
There is a mountain of evidence to support using statins in people with diabetes.
Okay, so what kind of evidence are we talking about? Give me the highlights.
Well, they point to this massive meta-analysis, basically a study of other studies,
Okay.
that crunched data from over 18,000 people with diabetes across 14 different trials.
Wow, that's a lot of data. What did all that research tell us?
The results were pretty clear. For every 1 millimole drop in LDL cholesterol, that's the bad kind,
Right.
there was a 9% decrease in deaths from all causes and a 13% reduction in deaths from heart problems.
That's incredible. So managing my cholesterol could actually help me live longer overall, not just prevent heart attacks.
Exactly. And here's what's even more interesting. The benefit wasn't about reaching like a specific cholesterol number.
Okay.
It was all about how much you could lower your LDL.
So the more I can lower it, the better.
That's the takeaway. And there wasn't a point where lowering it further stopped being helpful.
That's good to know. So it's not just about getting below a certain number, it's about lowering it as much as safely possible.
Right. But remember, the report acknowledges that statins aren't for everyone. Some folks have side effects.
Yeah.
And that's where those alternative therapies we talked about, ezetimibe and PCSK9 inhibitors, can come into play.
Right. Those are the options you mentioned for people who can't tolerate statins.
Yep. And the report gets pretty excited about PCSK9 inhibitors in particular.
Okay.
They've shown to be super effective at bringing that LDL cholesterol down.
Okay, I'm intrigued. Tell me more about how these PCSK9 inhibitors work.
So they target a protein called PCSK9, which basically helps regulate cholesterol levels in your blood.
Okay.
By blocking this protein, these medications can like drastically reduce LDL cholesterol,
Okay.
often even more than statins alone.
It's like they're kicking those statins into overdrive.
That's a great way to put it. The report mentions trials where PCSK9 inhibitors, when added on top of the highest dose of statin someone could handle,
Wow.
reduced LDL cholesterol by a whopping 36% to 59%.
Wow. That's a massive reduction. So for those who need to get their cholesterol down aggressively but maybe can't handle high doses of statins, this could be a game changer.
Exactly. That's why the report highlights them as a potential option, especially for people who've already had a heart event and need to be extra careful about their cholesterol.
It's really amazing how many different tools we have now to manage cholesterol levels.
It really is. And it's not just about the quantity of options. It's about the fact that they work in different ways,
Right.
allowing for a much more personalized treatment plan.
That's such an important point. What works for one person might not be the best fit for another.
Right on now. While we're on the topic of cholesterol, let's circle back to that distinction between primary and secondary prevention that we touched on earlier.
Okay, so to refresh my memory, primary prevention is all about preventing heart problems before they happen, right?
You got it. And for primary prevention, the report recommends starting with moderate intensity statin therapy.
So if I haven't had any heart issues yet, that's the first line of defense.
Exactly. But for secondary prevention, meaning after you've already had a heart event,
Yeah.
the recommendation shifts to high-intensity statin therapy.
Makes sense if you've already had a heart attack or stroke. You're at higher risk, so a more aggressive approach is needed.
Exactly. And the report stresses the importance of hitting those specific LDL targets we discussed earlier, below 70 milli-GDL for primary prevention and below 55 milli-GDL for secondary prevention.
It's like setting a clear goalpost for your cholesterol.
Right. And that's why regular checkups with your doctor are so important.
Yeah.
You know, they can help you track your progress, make any necessary adjustments to your medications, and address any concerns you might have.
It's a true partnership between you and your doctor.
Yes.
You're both working together to achieve those heart health goals.
Precisely. But let's not forget about those lifestyle changes we were talking about.
Right, diet, exercise, all that good stuff.
They play a huge role in managing cholesterol levels, and the report specifically calls out the DASH diet
Okay.
as a great way to both lower blood pressure and improve your cholesterol.
Double win.
Exactly. And don't underestimate the power of regular physical activity.
Yeah.
It not only helps with weight management, but it directly improves your cholesterol levels and your overall heart health.
It's amazing how much of an impact those simple lifestyle changes can make. Sometimes it's easy to forget the basics.
It is, and the report emphasizes that even small changes can add up to big benefits over time.
Yeah.
It's all about finding ways to incorporate those healthy habits into your daily life one step at a time.
I love that perspective.
Yeah.
It's not about making drastic changes overnight. It's about making sustainable changes that you can stick with for the long haul.
And that's a message that resonates with everyone, no matter where they're at on their health journey.
This deep dive into the world of cholesterol management has been so insightful.
Sure.
We've talked about statins, those LDL targets, alternative therapies, and the ever-important role of lifestyle.
And we've seen how all these pieces fit together to help lower heart risks for people with diabetes.
Right.
But hold on, we still have more to unpack. Remember that discussion about aspirin therapy?
Yes.
We only scratched the surface.
You're right. I'm really curious to hear more about what the report says about aspirin. especially those intriguing findings from the ASCEND trial you mentioned.
Yes.
Lead the way. I'm ready to keep diving. Okay, so let's unpack this aspirin mystery. You mentioned some pretty interesting findings from a study called the ASCEND trial.
Yeah, the ASCEND trial was huge. They followed over 15,000 people with diabetes who didn't have any existing heart disease.
15,000 people. That's a pretty big study.
It is.
What exactly were they looking at?
So they wanted to see if taking a daily low-dose aspirin would help prevent heart attacks, strokes, and other, cardiovascular events in folks with diabetes who hadn't experienced those issues yet.
Okay.
So remember, that's what we call primary prevention.
Right, stopping those problems before they even start. So did it work?
Well, the results were a bit of a mixed bag.
Okay.
The group taking aspirin did have a 12% lower risk of those major vascular events.
Okay, that sounds promising. So is the report saying everyone with diabetes should be taking a daily aspirin?
Not quite that simple. There's a catch.
Okay, I figured there had to be a catch. What is it?
Well, the study also found that people taking aspirin had a higher risk of major bleeding, especially in the stomach and intestines.
Oh, so it's a trade-off. Lower risk of heart problems, but higher risk of bleeding.
Exactly. And that's why the report really emphasizes the importance of talking to your doctor about aspirin. It's not a decision to be made lightly.
Yeah, they can help you weigh the risks and benefits based on your personal health history.
Absolutely. Now, shifting gears a bit, let's talk about those exciting new medications for type 2 diabetes we briefly touched on earlier, SGLT2 inhibitors and GLP-1 receptor agonists.
Yes, you've really piqued my curiosity about these meds. What's all the buzz about?
These medications are remarkable because they go beyond just lowering blood sugar. They've actually been shown to protect your heart and kidneys.
Oh, wow.
It's a major breakthrough in diabetes care.
Okay, I'm all ears. Tell me everything.
Well, the report is jam-packed with evidence from clinical trials that back up these claims. There's a whole wealth of research on the impressive cardiovascular and kidney benefits.
So it's not just hype. This is based on solid science.
Exactly. So let's break it down, starting with SGLT2 inhibitors.
Okay, SGLT2 inhibitors. How do they work their magic?
So think of your kidneys like tiny filters that clean your blood and remove waste products.
Okay.
SGLT2 inhibitors work by blocking the reabsorption of glucose in the kidneys.
Okay.
This means more sugar gets flushed out in your urine, lowering your blood sugar levels.
So they're like little helpers in my kidneys, making sure that extra sugar doesn't hang around.
That's a great way to put it, but the really amazing part is how this mechanism actually translates into heart benefits.
Okay.
Multiple trials have shown that SGLT2 inhibitors can significantly reduce the risk of major heart problems, including heart attacks, strokes, and even death from cardiovascular causes.
Wow. So they're not just lowering my blood sugar, they're directly protecting my heart. That's huge.
It is, and there's more.
Okay.
They've also been shown to reduce the risk of heart failure and slow down the progression of kidney disease.
Wow.
Both of these are major concerns for people with diabetes.
It's like they're tackling multiple problems at once.
Exactly. They address these interconnected aspects of metabolic health, which is what makes them so game-changing.
Okay, that's super impressive. Now, tell me about GLP-1 receptor agonists. How are they different from SGLT2 inhibitors?
So GLP-1 receptor agonists work by mimicking the effects of a naturally occurring hormone called GLP-1. This hormone helps regulate both blood sugar and appetite.
So they're basically giving my body a boost of its own natural blood sugar controller. Interesting.
Right. And just like SGLT2 inhibitors, GLP-1 receptor agonists have also been shown to lower the risk of those major cardiovascular events, heart attacks, strokes, and cardiovascular death.
So both types of medications offer significant heart protection. That's fantastic news for people with type 2 diabetes.
Absolutely. And, the research in this area is constantly moving forward. New trials are coming out all the time, further solidifying the role of these medications in protecting hearts.
It's an exciting time to be living with diabetes with so many new treatment options becoming available. It gives people more control over their health and a greater chance of living longer, healthier lives.
That's the real takeaway here. The report highlights that while diabetes is a serious condition, it doesn't have to define your life, with the right approach, which includes both medication and lifestyle changes. You can manage it effectively and minimize its impact on your overall well-being.
This deep dive has been absolutely incredible. It's amazing how much progress has been made in understanding and managing heart risks for people with diabetes. We've covered so much ground, from traditional approaches like blood pressure and cholesterol control to these cutting-edge medications like SGLT2 inhibitors and GLP-1 receptor agonists.
And let's not forget the power of those fundamental lifestyle habits: a healthy diet, regular exercise, maintaining a healthy weight, and quitting smoking. Those are essential for everyone, whether you're living with diabetes or not.
Absolutely. It's a great reminder that we all have a role to play in protecting our heart health.
So as we wrap up this deep dive, I'm curious what's resonating with you the most. What new insights have you gained that you can apply to your own health journey?
Personally, I'm blown away by the potential of these newer medications for type 2 diabetes. The fact that they can lower blood sugar and protect your heart and kidneys is truly remarkable. I'm definitely going to talk to my doctor about these options at my next appointment.
That's fantastic knowledge. It's a power. And understanding these latest advancements can empower you to make informed decisions about your own health.
And that's what the deep dive is all about. We're here to help you navigate the complexities of health information, extract the key insights, and give you the confidence to advocate for your own well-being.
Until next time, keep diving deep.